Welcome back everyone. In this particular video, we'll be diving in deeper about the methods of assessment, mainly clinical assessment that will be on the form of oral exams, long case exams, short case and OSCE methods of assessment. Fine. So before going into the major thing, we will learn about little bit about the oral exams. Okay, what are the structured oral exams? What are they otherwise called as? Structured oral exams otherwise called as vivavos, right? Viva voce, then it is also called as oral assessment. Okay, oral assessment. Otherwise, it can be termed as interview exams. Okay, in written exams, what happens? They actually only assess the theoretical knowledge, right? But in oral exams, they assess the understanding, clinical reasoning, and decision making in the real time by the method of verbal conversation. Okay, verbal conversation or verbal questions. So that is evaluating the ability of the student to articulate their skills in understanding, clinical reasoning and decision making. There is a major method of assessment in the healthcare or medical system. Fine. So we will be learning about the components of the structure oral exams. Okay, this structure oral exams can again have certain composed components, that is long case, short case, and also OSCE. OSCE also comes under the structured oral exams. Fine. So here we will be learning about this thing. These are the basic. This is the basic pyramid of the competence or assessment pyramid. Fine. The first or basic thing is we will be learning if the student knows or what. Okay. This is done by written exams. It can be MCQ method or essay method. It can also be done through oral exams, just regular asking. Fine. Next is if the student or the learner knows things, okay, knows how to apply this knowledge, that is knowing how to do, that assesses what, that assesses the competence. That competence is seen via case based assessment. Okay, the case is given, the student is told to assess it. It can also be done via MCQ, means structured MCQ or complex MCQs, or essays also can be done. That is a theoretical or a written aspect of it, but case based assessment is done via this MCQ, essay or oral. Fine. And now the student has to show how it is done. Okay, this knowing how, it is just basic understanding or basic articulation of their knowledge. Now they have to show their skills. That also is an aspect of competence, right? So that is done via the OSCE and standardized patient. SP means standardized patient based test. So standardized patient can be uh, simulation, or it can even by putting intern doctors or any other medical student as a, they can stand in for the patient. Okay, that is standardized patient, or it can even be regular patients also. Okay, that is the showing how to do things, just a clinical skill assessment. Next, does means the doing of the actual work that is done in the practice. Okay, that is not actually considered to be an assessment, but yeah, performance assessment can be done when the student actually deals with the real time patients and real time or real life problems. Fine. So knowing is done by written exams. It is context free because we do not have a patient in front of us, we do not have a case in front of us. We'll just ask and get the answer. Okay, for example, in the, yeah, the medical education, the anatomy, physiology, where the patients are not involved, the viva is done by just asking if the student knows how to do those things. So that is done, that is having a context free nature, and that can be done by the essays, that is written exams. MCQs, again a kind of written exam, and an oral viva. Okay, that is a viva post. Then we have knowing how to do things, that is a competency based thing. The student is given cases or case description, and they are told to assess the case and give their own decision making points. So that can again be done through complex MCQs. That cannot be a direct one on one MCQ. It should be a little bit complex to understand the knowledge of the student. Okay. Next is essay. It can be done via essay. It can be a context based case question which is presented in the exam. The student has to analyze the case and write down an essay on how to manage the case or in different procedures involved in the case. Next, it can even be by vivavos or the oral exams. Then finally, the student has to show, right? Next point is student has to show their skills. Show their skills. That is again a competency based thing that can be done by OSCE. What is OSCE? Objective, structured, clinical examination, right? And it can be even done by standardized patient method or standardized patient test that can be done by stand-ins for the patient. Okay, by the stand-ins for the patient, that can be a student, that can be an intern, or it can be anyone who can just act as a stand-in for the patient, or else it can be a well-versed patient also. Okay, just the skill has to be demonstrated. Then finally is the doing part, that is assessed in the clinical setting, in the real life setting. The performance is assessed there. Okay, knowledge is assessed here in the first strata, then the understanding is assessed in the second strata, the skill is assessed in the third strata, and the performance is assessed in the last strata. Okay, now we'll deal with each of the components: long case, short case, and Osce system. Long case, it is actually a comprehensive assessment, right? A long case is given, the student will evaluate the patient in depth. Okay, we'll give a chronic case. Okay, in medical field, it is a chronic case usually given. The patient will in depth understand the patient's condition, give their history. So history taking is the first and foremost step. Then the student will examine and, if possible, diagnose and formulate the management in depth. Okay, management plan will be kept in depth. So that is a long case examination. History taking, physical examination, diagnosis, formulation, and the management plan is in depth understood, and that is assessed. Okay, all these steps are assessed by the examiner in the long case examination. Fine. So that is the main thing. It is usually done for chronic diseases because that is a major one which is used. It can even be an acute case, a subacute case most probably. Fine. So a detailed patient history, conducting thorough physical examination, and formulating a diagnosis and management plan. All these steps have to be done, and it should be fulfilled. Okay, then the student has to present it, right? Presentation, present all these things have to be presented. The findings has to be presented to whom? To the examiners. Okay, to the examiners, and they have to justify. Not only present, they have to justify why they chose the particular diagnosis, why they chose the particular management, what is their points or what is their insight into the particular case. That has to be presented and justified. That is about the long case examination. This obviously every time it is done in the medicine field and healthcare field, it has to be completed. Fine. Next is the short case examination. Short case is actually a brief one, focused assessment. Typically takes only 10 to 15 minutes. Should take only 10 to 15 minutes. A specific medical condition is given to a student, and they have to evaluate that specific medical condition, and it should this goal is to actually identify whatever are the clinical signs and summarize the findings quickly. The quick thing is important here. It should take only 10 to 15 minutes, while long case it can take to 1 or 1.5 hour, mostly more than half an hour. Fine. So here it might be, for example, it can be a neck lump examination. Just the focus has to be on the neck lump only. Okay, maybe the examination portion of the neck lump, or the consistency, mobility, all those different kind of neck lump, yeah, all the different kinds of procedure of the examination has to be followed. They can even identify if is it a thyroid nodule or a lymph node or any other mass. All the characteristics have to be mentioned. Okay, here specific instruction will be given to the student, and the assessment is done on how quicker how accurately the student can identify the clinical signs. Okay, accuracy and quickness. Okay, accuracy and quickness is assessed in here. Okay, it's focused and it should take smaller amount of time. Okay, and it is towards a specific condition. It won't be a enormous medical condition. It is usually an acute case, because acute case usually have a specific condition. Okay, acute or even subacute cases. Chronic cases can be taken while only partial examination is done in short case examination. Fine. That is about short case examination. Now coming to Osce system. See, in this figure I have given different stations are there, different stations where students are standing over there and looking up into the different, yeah, one cardboard is kept over that, the paper is there, and in the paper there are certain instructions that is kept. Okay, instruction or questions. So here in Osce system of methodology, it is a standardized. See, this OSCE full form, it is objective structured clinical examination. Always remember, it is a standard procedure. Okay, all the long case, short case are actually or are usually subjective. Okay, the examiner has to get satisfied with the student's skills, and only the student will get enough score. But OSCE system objectifies everything. Okay, the students are told to do a certain standardized format. Okay, certain clinical skills have to be assessed in standardized format. Okay, one might be about the vital sign examination, or one might be about blood pressure examination, one might be about auscultation, right? So the student number 2 gets auscultation of the cardiac area. Okay, auscultation of the cardiac area, so she does only that. Okay, only that. But before doing that, all the steps of OSCE have to be done. The first and foremost about before doing an OSCE examination is sanitizing. Okay, that has to be followed throughout, right? If this person goes to the next station again, if another examination has to be done again, she or he has to do a sanitization, then ask for consent. See, these steps are already pre-made and pre-formed and given to the examiners, and these examiners see to it that the student follows. If they follow, they'll get the score. If they don't follow, they won't get the score. That is a basic objectivity in the OSCE system. Okay, that maintains the consistency throughout. So yeah, these stations are available, and the student rotates. Okay, after completing this area, she or he will rotate to the next station, then from there to here. So it will move on. The complete rotation is done, and every student gets opportunity to answer all the stations. Okay, so students will rotate through the stations, focusing on the specific skills which have been asked to demonstrate, and standardized checklist will be there, like sanitizing, asking the consent, maybe for abdominal examination, for taking a proper check for the privacy of the patient, and then asking for consent, then asking the patient to fold their legs. So if the student is asking the patient to flex their knees, that is actually one more point, right? That also gives a score to the patient. So sorry, score to the student. So on the basis of these checklist, if the student has done certain things, she or he will get a point. So on the basis of that, the students are assessed. Fine. So it is a standardized station based examination. Okay, it is a station based examination, assesses a wide range of clinical skills. Okay, and obviously because it is only a single skill is examined, the patient also will not feel overly utilized, and because it specifies on or focuses on specific skill, it will be easier. Okay, time will be lesser, because typically one station will require how much? Only 5 to 10 minutes per station, right? So within 1 hour only, all the students will complete, right? Within 1 hour, 6 students will complete their OSCE examination, right? So similarly, it should only typically last 5 to 10 minutes, but because they are rotating, wide range of skills are examined, and also because of standardization of checklist, it will be objective. Okay, short case are not objective, because here also examiner's point of view matters, but here, because the examiners are given a checklist, it makes it more standardized and objective. Okay, that is the plus points of having an OSCE exam. Fine. So remember the full form of OSCE: objective structured clinical exam. It is objective in nature, it is structured because they are getting a checklist, and it is clinical exam because the clinical skills are, or clinical task or clinical skills are assessed. Okay, it can be a patient history, it can be a physical examination, or interpreting any diagnostic result. Okay, one station might contain only a blood report or a CBC report or a CT scan report or an X-ray. Okay, they just have to interpret it, so that will assess the interpretation or diagnostic skill of the student. Okay, so that is about the OSCE system. Next, moving on to the advantages of these structured oral examination. The major advantage is real-time clinical reasoning, right? It allows the direct evaluation of student. Okay, students' thought process and also decision making skills, how the students think, how they make the decisions. Okay, all these are directly evaluated at real time setting. Okay, it is not that the student is getting feedback 1 or 2 months afterwards. It is available then and there only. Okay, So that is about the real-time clinical reasoning assessment. Then assessment of communication skill. It will evaluate if the student is able to explain it, explain their own thought process, explain their reasoning, okay, and how they communicate with the patient, communicate with the um, examiner. So medical information, if it is properly communicated or clearly communicated with the staff involved, okay, or colleagues involved or the patients involved, all the things are seen, okay. Communication with the examiner, communication with the colleagues, and communication with the patient, everything is assessed via the structural oral examination, right? Next is about flexibility and adaptability. See, this will allow the examiners to adapt questions based on the student's response, okay. The student is easily giving out answers to the easy questions, the examiner can directly go on to the difficult questions and try to see if the student is capable of answering that. So if the student is again capable of answering the difficult questions, the examiner can increase or raise the bar of the question level of questions, right? So thereby understanding the area or the level where the student is present and their level of understanding, okay. If the student is not able to answer the difficult question, the examiner can move on to the basic questions and try to see if the student has the basic understanding of the subject or not, okay. They can adapt their questions on the basis of the students responses, fine. So that happens mostly in long case, okay. That happens in mostly long case, and even to a even to an extent in short cases, fine. So that was about it. Now coming to the communication skills, it is done mostly in all of the types, in the short case, long case, and even Osce, because Osce has one place or one criteria where the student has to communicate with the patient what they are supposed to do, what they are trying to do. They have to explain the procedure to the patient. That will again assess the communication skill, right? So Osce has all those things, and except for flexibility, because Osce is comparatively rigid, so flexibility and adaptability is more prone for long case and short case, fine. Now this has certain limitations also, okay. Even though it is having so many good points, it is also having certain limitations. It is subjectivity, right? As in case of long case and short case, subjectivity is playing a major role here, because different examiners might interpret and evaluate responses differently, okay. So that can lead to inconsistencies. That is the problem with subjectivity in scoring in long case and short case, okay. But in Osce system, that is abolished, okay. Osce system doesn't have any subjectivity. It is by full form only, it is objective structure, right? So that is there. Examiner variability I've mentioned. Effectiveness of this oral exam can have not can it will depend on the effectiveness on the examiner's expertise. If the examiner is expert enough, if their questioning style is good, then the assessment is said to be proper or effective. If the examiner itself have lesser knowledge about the subject matter or specific condition, that will lead to different kind of output, right? So caliber of the examiner have to be ensured, okay. Before going into an examiner role, their caliber have to be understood and assessed, then only they can act as an examiner, okay. Next one is student anxiety. Obviously, most of the people have some kind of anxiety, right? Particularly for the student who need this on spot thinking. That is why major amount of students will go blank in front of the examiner, even though they have scored good in the written examination and they know the subject thoroughly. Because of this anxiety, social anxiety, or any kind of fear of facing other people, there might be people like that, right? So that plays a role in the oral examination or oral assessment. They might be so nervous that they forget the whole thing, they forget how to explain a certain thing, okay. Or maybe it can also hamper their vocabulary. Medical vocabulary is important in while explaining long case, short case, and everything, right? So that might be hampered, okay. When under constant scrutiny and constant observation, the anxiety will increase, and that will cause problems in assessment, okay, because of stress, and the performance will be affected because of the anxiety and the stress, okay. So that was about the types of oral exams. Remember about the short case, long case, and Osce systems. the advantages and disadvantages. Osce, the advantage is about its objectivity, about its structured method, okay, and about its less time consuming and assessing the various skills in a proper structured manner, okay. So that was about the this thing. Next important point or next important system of thing is about the assessment. What are the types of assessment, okay. We have already dealt about the diagnostic, formative, summative assessment in short. Now we will learn about it in detail, okay. So here the assessment types, I've already mentioned what is the need of assessment: to guide the students learning, to understand their progress, provide the feedback, and evaluate the educational outcomes. All these exams, written exams, oral exams, everything is done to assess the students outcome or students progress. And if the students progress is good, we can appreciate them and guide them in a proper way. If it is not good, we can again guide them, make them understand about the concepts, and it will help in the proper understanding or proper development of the student, okay. And finally, if the educational methodology is not working, there can be changes made to the educational methodology so that it can bring better outcomes in the student. Fine. So now we will have different types of assessment. We know about the formative, summative, it's already dealt. Periodic assessment is another kind. The ones which will not be dealt here, it is about the diagnostic assessment. Diagnostic assessment is done when it is done in the beginning, right? Beginning, to understand the knowledge, okay, to understand the knowledge of the student about a specific subject, right? So then only the teacher can tailor their class or session on the basis of the student's knowledge, okay. Now moving on to the formative assessment. I've already mentioned in the previous videos what is formative assessment. It is done along with the learning, okay. It is done along with the learning. What is the need? It is to monitor the learning if the student is able to understand what they're asking. For example, a class is going on. In between the classes, the teacher might ask the students short questions to understand if they grasp the particular topic or not, right? So the primary goal is to identify any learning gaps if it is present, okay. So any learning gaps if it is present, the teacher can understand and try to explain it more, thereby improving their teaching methodology and improving the retention in the students, okay. So this formative assessment, because it monitors and it is along with the actual learning, it is a continuous feedback, okay. The teacher gets a continuous feedback from the student and vice versa. Student also gets continuous feedback from the teacher. Student can also understand their level on the basis of formative assessment, right? So it provides continuous feedback to the student and helps the student to identify their own strength and where they can improve, okay. That is about the formative assessment characteristic. First is continuous feedback. Ongoing insights are given, because when the teacher asks the questions, the student will be able to answer or they won't be able to answer, right? If they're able to answer, well and good, the student is progressing properly. If the student is not able to answer, student can understand their lacuna and the teacher tries to help the student through that problem, okay, thereby improving them, okay, improving the students. Next is diagnostic. It is also diagnostic in nature, in the sense it can understand the misunderstandings, okay. If the student is having any misconceptions or misunderstanding about a certain topic, that can be understood while teaching only, okay. So it can identify the misunderstandings initially itself, and that can be addressed formally, okay, addressed promptly. So any learning gaps, everything can be diagnosed and it can be addressed promptly. Next is student centered, right? Formative assessments are always student centered, because a student is getting the benefit from it. They will be able to understand their knowledge, monitor their own knowledge, and they can reflect upon their uh, actions. So similarly, it encourages self-assessment, encourages reflection, and because the question has been asked, the student will engage actively, right? Because the student will know formative assessment is a part of learning. So thereby the teacher will ask questions. If the teacher will ask questions, student has to properly listen to the class. It cannot be a passive learning. It has to be an active learning, so that the student can listen, understand, and then try to answer whenever the teacher is asking questions, right? So this formative assessment promotes the active learning and active participation or active role of the student in the learning process. Okay, it empowers the student. Fine. Even even though grades are not given or points are not scored in this formative assessment, it will help in further clarification and further improvement of the students' understanding about the topic. Fine. Next, moving on to the examples, yeah, quizzes and polls. Okay, quizzes in the classroom. In a classroom environment, quizzes can be there. Classroom discussions, that is another form of formative assessment. A topic is given, the students are told to discuss, or the discussion can be taken place in between the students and teachers. Thereby, discussions can take place, and whenever discussions take place, that will improve the critical thinking aspect, right? So that will again increase the active learning process. Next is peer review. So whenever a question is asked in the class, it is not only the teacher that is assessing, it is also the peers, the colleagues, or the students who are there present in the classroom. They can also assess, they can also understand their own understanding, and also the student who is being asked questions. So that will develop the critical analysis skill. If the student is asked, if one student is asked a question, student one is being asked a question about a certain topic, and they answer it partially, student 2 might think, right, this particular point has been missed. So in their own mind, they will critically analyze their question and see the lacunae and understand what is being missed, and they will try to cover up that one in their own mind, or they might even vocalize their opinion also. Okay, that increases the active learning aspect of the formative assessment. Okay, next, moving on to summative assessment. Yeah, certain advantages. Remember, it is immediate feedback, right? It is along with the ongoing learning process, and it has low stakes because, see, because scores are not given, grades are not given, it is low stakes. Because whenever a summative assessment, I've already mentioned in the earlier video, summative assessment takes place in the end, means the final exams, the stakes are high. On the basis of the summative assessment scores, the student will either get promotion, or they might get a bit better career opportunity, or it actually is, on the basis of the summative assessment, the student can progress in their life, right? But formative assessment is not like that. It is purely learner centered, the learner's knowledge, learner's understanding, and because of that low stake in setup, the stress levels will be lesser. Stress levels, when it is lesser, the student learn better, right? So that is about the formative assessment. Next one is summative assessment. When it is done at the end of the instructional period. Okay, after a session is done, or after a course is done, at the end it is done. The summative assessment is done. What is it do? It does what it does is to evaluate achievement. Okay, evaluate achievement, if the student has achieved the particular learning goal or not, the student has properly understood or not, right? So it will assess the student's knowledge, and it can be even skills and the performance, okay, against certain benchmark. For example, minimum 50 percentage marks have to be present to pass the test, right? That is a basic thing in all the tests of the medical colleges, right? 50% marks have to be there. So these benchmarks are set up. Okay, these benchmarks are set up to assess a student's knowledge. Okay, if it is less than 50 percentage, student has to repeat the whole thing again, right? And then come back after the completion of course, and then give the summative assessment again. Remember, it is evaluative in nature. That is a characteristic. It is evaluative in nature, evaluates the understanding, evaluates the learning, and evaluates the knowledge of the student at the end of the course. Fine. So it assesses the learning outcome. Formative was to monitor, summative is to evaluate. Fine, remember that. Yeah, next one is about the high stakes. Remember how formative assessment was low stake environment because there is no grading system happening, but here we know the stakes are high because 50 percentage marks have to be maintained, otherwise students will fail, and that will affect the grades, right? The students fail, then they have to repeat the whole thing again. So on the basis of the summative assessment, if the student scores this 50 percentage, then only they'll pass. So the stress levels are higher. Okay, stress and anxiety levels are higher, and that will be not that much better, right? So certifications, grades, and advancements onto the next level. If the student doesn't pass this first year, then they cannot go into the second year class, right? Second semester, first semester, if they don't pass, they will get backlogs, right? So that is the advancements through the through the level of education and also their certifications. For example, the yeah, NTET exam itself is a certification exam, that is a summative examination, right? AIPGAT, NTET, UGC net, all these are the certifications exams, and they evaluate our knowledge. Okay, they evaluate our knowledge, and they have high stakes. If we do not get 50% or above in the NTET, we won't be getting the certification. If they do not get a probable or higher percentile, they would not get admissions in the MD, right, in the AIPGT. So similarly, these are high stakes environment, so stress levels are high, and that can significantly affect the students also. That is a different part. But yeah, next is standardize. See, because it is a high stake environment and all students have to be assessed, a certain fairness has to be ensured. Okay, that is done via standardization of all the exams. So all the people will get same set of questions or same set of treatment in the summative assessment. Okay, so that we can compare in between the students, or compare the students across the groups and also across each other, right? So the standardization is done by standardizing the procedure or standardizing the question pattern. Okay, same set of questions are done or given to the students so that they can assess it properly. So the examples of summative assessment are like final exams. It can be standardized tests like the SAT test, GRE test, right? Licensing examination, the NTD test, AIPGT exams, all those things. And next one is portfolios. Okay, portfolios, e-portfolios we have mentioned earlier in the one of the videos, right? So e-portfolio making, then final project. Okay, final project in the end of the particular semester or session, that can again be a type of summative assessment. Okay, exams and test, projects, paper assignments, essays, then portfolios, presentations. Okay, presentations at the end of the classes. Then standardized assessments test are like the NTET, then the AIPGT, NEET UG, NEET PG, all the variety of tests which is available in our um, area, right? SAT exams, then the GRE exams, then quizzes. Okay, performance based assessment that is done in the Osce system also, that is also considered to be a summative assessment. Okay, so all these are the examples of summative assessment that is done to evaluate the student's knowledge. Fine, evaluate if the student has learned properly or not. This is not a learner centric thing. Okay, this is formative assessment is learner centered, but summative is not as like that. Okay, it just assesses, it just evaluates. Next point, or next differentiation between this formative and summative, always remember, formative is student based, so it helps the student, right? Summative just assesses the performance, nothing else. Formative is done throughout the course. Okay, it identifies the gaps in learning and improves them. It focuses on the process, but summative focuses on the end result. Okay, it collects the evidence if the student has learned or not. Student skills and knowledge is assessed over there. Okay, when it is done, it is done at the end. So these are the basic differences between summative and formative assessment. Okay, moving on to the periodic assessment, that is one more kind of assessment. This periodic assessment is actually done at regular intervals. Okay, that is why it's called as periodic. It is done at regular intervals. What does it do? It also monitors progress. Okay, just as that of formative assessment, this also does, what it does is monitors progress. Okay, so this has a dual purpose. Okay, it has a dual purpose. One is giving continuous feedback. Okay, student will get continuous feedback on their performance, and progress tracking. Okay, it can track the progress also. For example, in schools we have term exams, we have semester exams in college. Okay, or model exam, or yeah, first semester, second semester. These are actually periodic assessment. Okay, throughout the course, even if the course is for 3 years, semester exams can be divided into three: first semester, second semester, and third semester, right? Similarly, if the course or in lower class group, it might be 10th or board exams, before the final board exams, there might be term exams, right? 10th board is actually what? It is a summative assessment. Okay, summative assessment. On the basis of that, they can go for the 11th, whatever stream they choose or not. And the term exams are actually the periodic assessment, right? Term exams are done, and there might be midterm or yearly term. So there will be term exams, and finally we have a final exam. So term exams are called as periodic assessments, and board exams are actually a summative assessment. If you take a 10th class as a scenario, fine. The purpose is to do what? Purpose is to get continuous feedback. With the term exams, the student will understand their lacunae and they can learn. They still have time to learn before the summative assessment, right? And with that, the progress of the student can be understood, and also a track can be kept. Okay, if the student is improving or the student is not improving, that can be understood. Okay, so periodic assessment can usually be formative or summative, or can be a combination. For example, semester exams are basically a combination of formative and summative, right? But term exams are actually formative. Okay, it can either be summative or it can be a formative, or it can be a combination of both. Fine. Now coming to the characteristics of periodic learning, first one, regular monitoring. Obviously, because of the particular continuous intervals that it is done, it is scheduled consistently, and it will improve the monitoring. Okay, regular monitoring can be done. Regular monitoring of what? Regular monitoring of the progress of the student can be done via the periodic assessment. Next one, balanced approach. Okay, because it can combine formative and summative assessments together, it will provide a balanced view. Because for example, in case of semester exams, if the first semester is not passed, if the student does not pass the first semester exam, they will have backlog of that, right? The exam is getting backlog. So that will again consider, that can be again considered as a summative assessment. On the same time, the student can understand their own progress, they can learn by themselves again, right? So the formative part of monitoring is there, and summative part of moving on to the next class, that is also there. So it is a combination of both summative and formative assessment. Okay, there is a balanced view, balanced approach to the learning. Fine. Progress tracking, another important one. It allows the teachers or the staff to track the progress of the student over time, and if at all the teachers, the students are not able to cope with the certain assessments, they can make adjustments, they can make improvements to the teaching methodology, and finally that will improve the learning process in whole. Fine. Now certain examples for periodic assessments are like midterm exams. I've already mentioned, right? Midterm exams and midterm exams. Monthly quizzes can be done to reinforce whatever learning they have done and to track the progress. So midterm exam is in between the course. In between the course, midterm exams are done. So after maybe half of the syllabus is done, the teachers can conduct the midterm exams, where the assessment is done, understood if the student is able to cope up with the whole curriculum, not if the and if the student needs more support, that is given. If it is fine, well and good, the progress can be tracked, so and so. Fine. So progress reports, remember how in schools we used to get the progress report, right? In the progress report, the term exams, midterm exams, everything used to be written, right? So that summarizes the whole performance of the student, okay, over a period of time. So it is done in the lower educations, like the primary and secondary educations. Once the higher education is done, there it is not done. Okay, there the progress reports are not usually maintained. So this was about the major aspects of assessments: periodic, summative, and formative. We learned about the long case, short case, and Osce systems, and we also learned about the different types of assessments, the importance, the examples, and how it helps in improving the students' learning, how we can support the students' learning, improve the instructions or the teaching practices, and how we can ensure that the students are well prepared for the future challenges, because we are assessing the students' knowledge, how they can perform it, or if they know how to perform, and how they are performing in a control setup, and how they are performing in the real life situation. Okay, we are actually shaping the students' future. That's it. Okay, via this feedback assessment, all the strategy is to actually evaluate the student and thereby give our own inputs and improve them. Okay, with this we finish the assessment section of the entities topics. So we'll move on to the next topic in the next videos. All these videos are uploaded into the playlist. You can watch it again if you need. If you have any doubts, you can just ask in the comments. We will reply anyways. um, Thank you for listening. Please make sure to subscribe or share this video to whoever is looking for certain class, these kinds of NTT classes, and make sure to solve the MCQs, because then we will be able to understand where we are lacking. So we are having a problem. Okay, so that is a kind of self assessment in itself, right? So thank you for listening. Have a nice day.